Hello everyone. Today I am going to talk about ethical issues in robotics and automation in surgery. Introduction to robotic and automated surgery means using machines, robots and computer systems to perform or assist surgical procedures. Examples include the Da Vinci surgical system and autonomous biopsy robots. These technologies are becoming more common in modern hospitals because they help surgeons work with more accuracy. The promise of robotic surgery. Robotic systems allow surgeons to perform very precise and minimally invasive procedures. Because of this, patients usually have smaller cuts, less pain, faster recovery, and shorter hospital stays. Robots also reduce physical strain on surgeons by giving better control and stability. Automation in surgery. Automation in surgery exists at different levels. Assistive, the robot helps, but the surgeon controls everything. Semi-autonomous, the robot performs some tasks under supervision. Fully autonomous, the robot can perform certain steps on its own. AI is used for decision making, image guidance, and predicting surgical outcomes. Ethical principle in medicine. All new medical technologies must follow basic medical ethics. The main principles are autonomy, respecting patient choices, beneficence, doing good for the patient, non-malfeasance, avoiding harm, justice, ensuring fairness and equal treatment. Robotic surgery must follow these principles. Autonomy and informed consent. Patients must clearly understand how much the robot or AI will be used, what tasks the robot will perform, the risks and benefits. Transparent and honest consent builds trust and protects patient rights. Beneficence vs non-malfeasance. Robots improve surgical precision and reduce complications in many cases. However, doctors must ensure that new robotic systems actually provide real benefits and do not introduce new risks. The focus must always be on patient safety. Justice and access. Robotic surgery is very expensive. Only rich hospitals may afford these technologies, while smaller or rural hospitals may not. This creates inequality in healthcare access, which is an ethical concern. Every patient should have a fair chance to receive the best care. Accountability and liability. If something goes wrong during robotic surgery, who is responsible? The issue is still debated. Another risk is algorithm drift, where AI performance decreases over time if not updated or retrained properly. Legal and regulatory challenges. Many countries do not yet have clear laws for AI assisted surgery. There is a need for standardized global rules to ensure patient safety, quality control, and ethical use of robots. Data privacy issues. Robotic systems collect large amounts of sensitive patient data, including images, recording, and medical information. If this data is hacked or misused, it could harm patients. So, strong cyber security and privacy protection are necessary. Algorithmic bias and fairness. If AI is trained on biased data, it may give unequal treatment to different groups of people. For example, if the training data is mostly from one population, the robot may perform less accurately on others. It is ethically important to check for bias and correct it. Transparency and explainability. Both surgeons and patients should understand how AI makes decisions. If the algorithm works like a black box and does not explain its reasoning, it reduces trust. Explainable AI helps build confidence and safety. Impact on surgical training. If robots do more tasks, surgeons may become too dependent on technology. This could reduce manual skills and confidence. Medical training should maintain a balance between robotic skills and traditional surgical skills. Human robot collaboration. Robots should be designed to work smoothly with the surgical team. Good teamwork, communication, and user friendly design are important. The surgeon must always maintain awareness and control during procedures. Emotional and physiological effects. Some patients may feel afraid or unsure about robotic surgery. Surgeons may also worry that robots reduce their role or importance. So, emotional support and clear communication are important for both patients and doctors. Emerging trends. Technology is moving towards fully autonomous surgeries where robots perform steps independently. AI is also being integrated with diagnosis, imaging, and surgical planning. This development brings new possibilities and new ethical questions. Ethical guidelines and governance. Organizations like AMA means American Medical Association, uh, WHO, and the EU AI Act are creating guidelines. These guidelines cover auditing, safety checks, certification, and ethical use. Strong governance ensures trust and responsible innovation. Towards responsible innovation, developers should design surgical robots considering human values and patient welfare. Ethics boards, medical experts, engineers, and policymakers must work together. Innovation should never compromise patient safety. Conclusion. Robotic and automated surgery offers many benefits but also raises serious ethical issues. We must balance technological progress with patient welfare, fairness, and accountability. Continuous discussion between technologists, doctors, and ethics is necessary for the future. Thank you.